thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, we're going to talk about losing a pregnancy, what that means, and how to move forward. So first, let's define what exactly pregnancy loss is. So when I say pregnancy loss or miscarriage, that means that you've had a loss of a pregnancy no matter how far along you were. Remember, the majority of miscarriages happen very early, with most of them happening in the first 6 weeks. After the first trimester, meaning after week 12, your chance of miscarriage goes down to about 5%, so you can breathe a little bit easier. Although your risk of miscarriage is higher in the first trimester, most of the time, 50% of the time that is, there'll be no cause for your miscarriage. Usually, miscarriages that are very early do not warrant any workup besides sending the remains off for chromosomal testing. However, if you've lost several pregnancies, that may require another workup, or if you've lost a pregnancy later on, meaning after 20 weeks, that could require further workup, which we'll talk about in this video. So when you have a miscarriage less than 20 weeks, you may see documented the phrase missed abortion or spontaneous abortion. Now those are insensitive terms, and it does not mean you've had an abortion, but that's the medical term. And so I'm letting you know this just in case you request your records and you see this documented. It does not mean you've had an abortion. It just means that you had a pregnancy loss less than 20 weeks. Let's say you have a pregnancy loss over 20 weeks. So that technically is called a preterm delivery. Anything over 20 weeks, even if the baby had no chance of survival, would still be coined a preterm delivery. So what are the symptoms of miscarriage? Usually people have vaginal bleeding and can have pain, but sometimes people don't have symptoms at all. Remember, cramping early in the pregnancy can be a very normal sign. Lower abdominal pain or tenderness in the pregnancy can be just from ligament stretching. So I'm not telling you this to get you alarmed, because these are also normal symptoms, which is why some people don't know that they've had a miscarriage. So, like I said before, some people don't know they've had a miscarriage and they go into the doctor's office and then there's not a heartbeat. Remember, if you over 12 weeks, the chance of that happening is very low. But if you've had that happen to you, you do need to let your doctor know before you've gotten pregnant so they can take steps to reduce your risk. Besides vaginal bleeding and cramping and pelvic pain, some people feel a loss of fetal movement, specifically if you're over 20 weeks or further along in the third trimester. Once you reach 32 weeks, you should feel your baby move about 10 times in an hour. And if you don't, you should contact your OBGYN and go into the hospital so you can be put on the monitor immediately. So let's talk about the causes of miscarriage. So early miscarriages, half of those are usually caused by a chromosomal abnormality. No, not something wrong with you, but just an abnormal chromosome arrangements that spontaneously occur. The most common chromosome anomaly is trisomy 16, which is not compatible with life. The most common chromosome anomaly for a live-born baby is Down syndrome, so you may have heard that before. Any baby with a chromosomal abnormality has a higher chance of pregnancy loss. So if you have a baby with a chromosomal abnormality, you should be monitored more frequently. Other causes of pregnancy loss include a heart defect or other structural abnormalities. Some babies are small because the placenta is not functioning well, and the placenta is coined the afterbirth, is not functioning well, so their baby ends up being smaller. They have a higher risk of miscarriage. Some people have abnormalities of their uterus. So if you've been told that you have 2 horns on your uterus, or you have 2 cervices or 2 openings of the uterus, or the shape of your uterus is odd, there's a higher risk of preterm births as well as miscarriage with those. Also, exposures to certain medications can put you at increased risk of miscarriage, or environmental exposures such as radiation, or you've been exposed to infections or viruses. So it's really important that you wash your hands during pregnancy, and really important that if you get sick, you should treat yourself very, very quickly. In addition to those issues, trauma, smoking, alcohol or drug exposure can increase your risk of having a miscarriage. So, what are ways to prevent a miscarriage? First, let's get rid of the exposures. So, if you have people that are sick, don't be around them. Get a flu shot to prevent yourself from getting the flu. The flu is very dangerous in pregnancy because your immune system is down and compromised. And so that could definitely put you at risk for losing the pregnancy. So staying healthy. If you smoke, stop smoking before you get pregnant. That's really important if you can, or gradually decrease the amount of smoking that you do until you can stop smoking. So the less exposure you have to smoking, the better. I always tell my patients, if you stop smoking, take down the curtains, wash them, shampoo the carpets, try to get all the toxins out of your household. Reduce your caffeine intake to about 200 milligrams a day, and that's equivalent to about 2 cups of coffee a day. Now, if you have something going on with your baby's heart rate, then your doctor would probably take you off of caffeine, so that is not applicable for this video, okay? But decrease the amount of caffeine. And then also maintaining a healthy exercise pattern is important, and maintaining a healthy diet is very important. So cutting down on the intake of fat. If you're not pregnant yet, dropping a few pounds can help. We know that people that have obesity have an increased risk of having stillbirths or miscarriages. And so if you can get down to your ideal body weight before pregnancy, that would help reduce your risk. Even if you can't get down to your ideal body weight, because let's face it, most of us aren't, we know that a reduction in even 10 pounds can reduce your risk of miscarriage with future pregnancies. If you have comorbidities, make sure those comorbidities are well controlled. And when I say comorbidities, I mean you have pre-existing medical conditions like diabetes, heart disease. Make sure those things are well controlled and you're the absolute healthiest you could be before you get pregnant. So if you're diabetic, you want to make sure your hemoglobin A1C is 6 or less. Look at my other video on diabetes for more specific things you can do to help your pregnancy. If you have high blood pressure, making sure your blood pressure is very well controlled. If you're on different medications for different diseases, make sure you review those with your OBGYN or maternal fetal medicine specialist to see if those medicines are safe in pregnancy or if they will increase your risk of miscarriage or birth defects, which then increases your risk of miscarriage during the pregnancy. So those are a few things that you can do to reduce your risk. But most importantly, know that the majority of miscarriages, we have no idea what causes them. So basically, being the absolute healthiest you can be will reduce your risk overall. Also know that if you've had a miscarriage, it's not your fault. Sometimes people have miscarriages, and like I say, 25 to 30% of people in their first trimester experience a miscarriage. I've experienced a miscarriage. It sucks to experience a miscarriage. Would not want anybody else to go through that. But unfortunately, it happens, and it's common, and you're not alone. I know half of my friends that have experienced a miscarriage, so you're definitely not alone. It wasn't my fault. It's not your fault. And so trust yourself and believe that it's not your fault. And yes, you can try again if you want a baby. You can move forward. I always tell people start prenatal vitamins and folate very early before you get pregnant. That also helps ensure that you have a healthy pregnancy. If you have had a preterm delivery, so something's wrong with your cervix, and you have had preterm dilation, so you didn't have a stillbirth, but you had a loss of a pregnancy because your cervix just dilated, talk to your OBGYN about interventions in future pregnancy. So if you had a loss of a pregnancy because your cervix dilated, not because of the baby, there are interventions that can be done really early on, such as what's called a cerclage, or a stitch to keep the cervix closed. And if you've had a preterm delivery with a loss, your doctor may also recommend that you be on progesterone supplements. Progesterone is a hormone that your body naturally secretes that tells your body, hey, I'm pregnant, please stay pregnant. And so some people have a deficiency in progesterone, and we don't know know exactly what those levels are. So your OBGYN probably won't check it, but will add supplementation because we know that everybody's levels aren't the same. And you could be deficient with a normal level, and so you should get added progesterone if you've had a preterm delivery for no apparent reason. Some people experience pregnancy losses and it's hard for them to bounce back from them. I think that losing a pregnancy is difficult, and coping with it, it does take you a little while to move on. Always seek help if you need further counseling. Your OBGYN would likely see you a couple weeks after you lose a pregnancy to talk to you about how you feel. You want to make sure mentally you're okay to have a pregnancy. We want to make sure mentally you're the healthiest you can possibly be before you're pregnant. And so sometimes that requires you to be in counseling. Sometimes that may require you to even be on an antidepressant to make sure you're feeling at your very, very best. So those are the tips that I have for dealing with pregnancy loss. I also believe that praying and meditation goes an awful long way. Just stay positive, stay motivated. No, it's not your fault. If you've had a pregnancy loss over 20 weeks, that always requires further workup to see if there's something chromosomally wrong with the baby, or if you had an infection or something wrong with the placenta or the afterbirth that caused that. Your OBGYN may also talk to you about an autopsy, which is basically a full examination of the baby after delivery to see if there was any causes that were undiagnosed, such as a heart defect or brain defect or some other structural abnormality. I pray and hope that if you've had a pregnancy loss, that you are coping with it positively, and I hope that you have the support system that you need to move forward. If you don't, please feel free to email me. I would love to help you get some support. If you have any specific questions, because everybody's situation is different, please feel free to reach out to me so that we can chat, or I can help direct you in the path of resources so that you can move forward with future pregnancies. Thanks for tuning in. Thanks for watching the video. You see that little click and subscribe below? Go ahead and click subscribe on the YouTube page. That way you can get all the latest videos as soon as they're posted. Also, don't forget to go to www.pregnancypearls.com, scroll to the bottom, enter your email address to subscribe to my blog as well. Thanks for tuning in.